Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune, and we conduct a lot of blood tests for patients with thyroid disorders. One of these tests is the anti-TPO test, and patients are often worried whether a high anti-TPO blood test result means that they could be having cancer. And this video is what I have created to dispel all the fears about this topic. Anti-TPO is a blood test done to measure certain antibodies that are made against the thyroid gland. Please check my video on the anti-TPO antibodies test for its details. Today I'm just going to talk about whether this means that you have cancer or not. So to begin with, what is the TPO? TPO stands for thyroid peroxidase. It's an enzyme that is necessary to make your thyroid hormones. This is a gland. The thyroid gland is the one which has this enzyme in it. The thyroid gland is located just below and around your Adam's apple, and this thyroid gland makes your thyroid hormones, and this enzyme is present. It's like a little chemical that is present inside your thyroid gland that actually helps the gland to make these thyroid hormones. So now what does this have to do with cancer? So basically the TPO antibodies are proteins that are made by your body directed against this enzyme. Why does this happen? Because your body begins to think that this enzyme is actually a foreign substance. It doesn't belong to your body, and it starts trying to attack it, thinking it's an intruder. That's why we measure the levels of these TPO antibodies. They should not be above a certain level. If they are above a certain level, it means that your thyroid is being actively attacked by your own immune system. So patients are usually worried what it means if the level of this TPO antibodies are very high. Does it mean that they have cancer? Now this is what I'm trying to answer. I've just given you some background. I've also mentioned here the normal range of the TPO antibodies. It varies from lab to lab. This is just one of the ranges that I've mentioned here. So to put your fears to rest, only 10 to 20% of people with very high TPO levels actually have cancer. TPO is not something that we use to detect, diagnose, or even monitor cancer. TPO is used to find whether you have an autoimmune disease that is attacking your thyroid. This is a disease in which your body's defense mechanism begins to attack your thyroid gland, thinking that it doesn't belong to your own body. This does not mean and does not have anything to do with cancer. Yes, we do sometimes find high levels of TPO in patients with cancer, but it is not something that means you have cancer. Now, anti-TPO just means that you have probably got an autoimmune disease like Hashimoto's thyroiditis or Graves' disease, which is causing your thyroid to malfunction. That's all that it means. So as I already explained to you, Hashimoto's thyroiditis is a disease in which your thyroid glands gets progressively destroyed because of attack by antibodies made by your own body against it. Your thyroid begins to function poorly and you begin to develop all kinds of symptoms. Graves' disease is another disease in which your body makes certain proteins that tend to overstimulate the thyroid and it causes the thyroid to overact. We also find these TPO antibodies in patients with Graves' disease. Neither of these diseases mean cancer. 10 to 15%, it is sometimes even found in normal people. Now 10 to 15% is just an estimate. It probably may be even lower than that. But you may even find it in someone who looks otherwise healthy and there is absolutely no problem with them. They don't even have any symptoms of any thyroid disease. But we still find that these TPO antibodies are present in their blood in higher than normal levels. So it doesn't even have anything to do. Sometimes you might even be totally asymptomatic. So what should you do? If your TPO antibodies are positive or high, does it mean that you definitely don't have cancer? This test is not done to either rule out or rule in cancer. You cannot say that you have cancer just because it's higher than normal. You cannot say that you don't have cancer. What you need to understand is that cancer is detected and diagnosed by other techniques. One of which is called fine needle aspiration cytology, where they will insert a little needle into your thyroid gland if it's showing a little nodule or a lump, aspirate some of the material from that and look at it under the microscope and decide whether there is a cancer or not. There are also other ways to diagnose cancer. There are other blood tests that are done, but TPO is not one of them. So if you think that you may be having something like a thyroid cancer, maybe you have a nodule in your thyroid, you have difficulty in speaking, you can't swallow properly, you have trouble swallowing your food or even drinking water, you should get yourself consulted. Go to a doctor who is a specialist, an endocrinologist, or even a general surgeon. Show them your thyroid gland, tell them about your symptoms, and ask them how to evaluate it for cancer. A TPO test result does not rule out or rule in cancer. Yes, there is a tendency, a slightly higher tendency for cancer in people with very high TPO levels, but that association does not mean that you have cancer. You need to get yourself checked with a professional, someone who is working in oncology or endocrinology, get a proper workup done. They will ask you to do maybe an ultrasound, maybe an FNAC, like I just said. Maybe they even ask you for they will go in for a little biopsy where a tiny piece of your thyroid is excised and then checked under the microscope. And only after all that is done can anyone tell you whether you have cancer or not. So there's no need to panic, but definitely consult a doctor.